My name is Henry Irby. Thank you for joining us here at the Jefferson County Sheriff's Office. In just a moment, you will hear from Sheriff Mark Petway. Also here is Dr. David Hicks and Dr. Jennifer McCain from Children's of Alabama. Last year, we launched a pilot program to distribute free gun locks across our community. Today, we build on that success. Here is how the program will flow. The rest of the way, we'll have remarks by the sheriff, and then the health department will give their perspective of what's occurring. And also, we'll do the same for our new partner, Children's of Alabama. We will have a demonstration on how to use gun locks by Detective Casey Markram. And we would then have a Q&A session after that. And then closing remarks and a photo opportunity. So at this time, please join me in welcoming Jefferson County Sheriff Mark Petway, who continues to be at the forefront of keeping families safe throughout Jefferson County. Sheriff Petway.
Good morning. I'm Jefferson County Sheriff Mark Petway, and I would like to thank you all for being here. Last year, during the Memorial Holiday weekend, we launched our very first gun lock giveaway in partnership with the Jefferson County Health Department. That pilot put forth hundreds of free locks into the hands of many of those that are in our community who needed them the most. We're thanking our health department partner. I want to extend special thanks to you, Dr. Hicks, and the entire team at the Jefferson County Health Department. Dr. Hicks, your leadership and commitment were critical to getting these initiatives off the ground. Thank you for joining me in making our community safer. Now, building on success with a new partner. This year, I'm proud to announce that we're growing this program in two important ways. Children's of Alabama has come on board as a new partner to help us increase our reach and share vital safety education with parents and caregivers. Now, let me turn it over to Dr. Hicks with the Jefferson County Health Department.
Sure. Thank you, Sheriff Petway. We're really excited to be here. My name is Dr. David Hicks, Jefferson County Health Officer. This is an example of how partnerships work on behalf of the community. At the Jefferson County Department of Health, we believe in being proactive, being preventive, and this is a really great example of that. We value every life. Every life is important to us, and we believe in a healthier Jefferson County for all. With this initiative, we know that we can take simple steps. A simple step of securing a firearm with a gun lock, simple gun lock, can have so much profound impact in people's lives. We're talking about safety for our youth. We don't want our young people to happen to come across a firearm that's unsecured and have an accidental injury or death. And one death, one injury is way too many for our community. And coupled with distributing the gun locks, really important is education. How do we equip people with the knowledge to take steps on their own to protect themselves and their families? And that's why I'm really excited about this. We're actually going to put a tool in your hands that you can use. We're going to equip you with information. And that's how we really can move the needle on this. And again, I'm excited because we're having a partnership with the Sheriff's Office. We're having a partnership with Children's of Alabama, and we are going to work diligently to be a part of the solutions and working collectively as a community. So thank you again, Sheriff Petway, for the opportunity to partner in this important initiative.
Hi, good morning. I'm Jennifer McCain. I'm a pediatric emergency medicine doctor at Children's. Thank you guys for having me here today. I really appreciate it. As somebody who's worked in the pediatric emergency department for years. I stand before you today as representative of other physicians and nurses and staff with deep concern and renewed hope regarding gunshot wounds. We've treated far too many gunshot wound victims in our department. The numbers are stark and heartbreaking. When I first worked in our emergency department back in the early 2000s, we treated approximately 25 children every year with firearm-related injuries. That was about 1 or 2 every month. Recently, that number has increased dramatically. Back in 2023, that number was up to 99. We had 99 children who were injured by firearms. And that averages out to 5 or 10 a month when it used to be only 1 or 2 a month. So we now increase up to a 4-fold increase in kids who are being injured every year, excuse me. But behind each of these statistics is a child, a family, and a community that's forever changed. I've seen 2-year-olds who've been able to use enough dexterity to be able to pull a trigger. I've cared for teenagers whose impulsive moments have turned tragic because a firearm was within reach. And recently, over the last several years, we've really treated multiple small preschool-age kids who have unintentionally shot themselves or another child with a gun that was left either in a vehicle, their home, or a family member's home. It was unlocked and loaded. And these aren't just numbers to me and our staff. They represent the most devastating part of our jobs. What makes all this much more painful is that many of these injuries are preventable. Firearms are now the #1 cause of death of children all over America, not just America, but here in Alabama and in Birmingham too. It surpassed motor vehicle accidents, drowning, and even cancer as a cause of death. In 2021 alone, 2,571 children died from firearm-related injuries. But here's what gives me hope. We know how to prevent many of these injuries. Just as we dramatically have dropped the number of injuries that have happened from car accidents through proper car seat usage, seat belts, safer cars, and from poisonings, we've improved those deaths from those with medication safety. We can also reduce firearm injuries with a simple gun lock. The safest way for families to store firearms is locked, unloaded, with ammunition stored separately. When firearms are properly secured that way, curious toddlers can't access them. Teens in crisis can't impulsively reach for them, and they can't be stolen and used for crime. So that's why I'm excited about this initiative with this group of people. Over the next year, we're all going to work together to provide free gun locks at multiple locations throughout our county. And this isn't about taking away people's rights. It's about giving families the tools they need to keep their kids safe. So to the parents listening to us today, 53% of Alabama's homes have firearms. If you're one of them, please take advantage of these free locks. Use them. Lock your guns up, store the firearm separately from ammunition, and keep it secure. And if your child's going to go to a friend's house, grandmother's house, neighbor's house, don't hesitate to ask them about secure storage. These conversations will save lives. To my fellow healthcare providers out there, let's make firearm safety discussions like this as routine as talking about car seats or bike helmets. Our families trust us to provide guidance on child safety. As emergency physicians, we become far too familiar with treating gunshot wounds in kids. But today we're taking action to ensure that fewer families experience this kind of devastating trauma. Together, we're going to be able to protect our kids and strengthen our community. Thanks.
Now we have Detective Casey Markram to demonstrate how the gun locks should be used properly.
All right. Hello, I am Detective Casey Markram. I'm going to just show you how to easily use one of these gun safety locks. First, we'll get it in a package. It will be just like this, or it should be similar. The key may be already inserted, but simply just rotate the key and then it comes open as such, right? Once you have this open, whatever firearm platform you have, and we have 3 different ones. We have a handgun, a rifle, and a shotgun. So let's start with the handgun first. The handgun, first thing we're going to want to do is not point it at anybody or anything, have it pointed in a safe direction. And then we are going to want to make sure that this thing is properly unloaded. So first thing you're going to do is remove the magazine from the weapon system, and then you're going to eject any live round from that weapon. Once we have done that, we are going to visually look inside to make sure that there is no ammunition inside of the weapon, and then we're going to physically check. Once we have done that, we look away from the weapon, and we do that once more. We visually and physically inspect the weapon twice. Once we have confirmed that this weapon is safe, we're going to take the gun lock. On this handgun, we will simply run it through the magazine well. Once we have done so, you turn it back and you just lock it in place, and then remove the key, tug on the lock to ensure that it is locked, and this is good to go, right? No magazine can go into the mag well. No round can chamber inside of the weapon on the handgun. Same thing goes with a rifle. Okay, this is an AR-15 style. What we are going to do is remove the magazine from the mag well, just like we did the handgun. We are going to lock the slide to the rear, or I'm sorry, the bolt to the rear. Then we are going to visually and physically inspect the weapon. We look away, visually and physically inspect the weapon to confirm that there is no ammunition inside of this weapon. Once we have done that, make sure that the weapon is on safe if there is a safety on it. The same thing, you would unlock it. We will take the gun lock. We will run it through the magazine well, come out the ejection port, and loop it back around. Lock it in on itself. Once we have removed that key from the lock, tug on it to make sure that it cannot, that it does not unlock. No magazine can go into the mag well. No round can go, or the bolt cannot chamber into the weapon system. All right. And the last thing is the shotgun. Okay, the shotgun's a little bit different because there is no magazine. The magazine is in here. So we are going to want to open the action and make sure that there is no shells inside of the magazine tube. We want to make sure that there is no shell inside of the chamber. If there are shells, we will have to eject those rounds, however your weapon platform is designed. And then we are going to visually and physically inspect 2 times, just like we have on the other platforms. The same thing. We will go ahead and run this through where the magazine tube is. We will lock this lock. There it goes. Once we have that locked, tug on it to ensure that it is properly locked. Now, you can still get shells, but it will not operate as intended. Okay, that's the 3 methods that we can use on all these platforms. Thank you.
The floor is now open for questions.
What is the actual giveaway for the unlocks? When is the giveaway again?
We've already started doing that. We started this program last year, and so we hope to do more this year. And so for those who are interested in getting a free gun lock, they can call one of our pistol license departments, and they can call 205-325-5728. We have one in Bessemer and we have one here. And so by calling that number, whichever one is closest to you, they'll direct you to it. Anything for the sheriff? Anything for Dr. Hicks? Dr. McCain?
Sheriff, why was it so important for you to partner with the Children's Hospital this go around?
This time, we added Children's Hospital to our partnership. In the past, we had Jefferson County Health Department who declared it a community hazard. Now, Children's Hospital have seen many cases where little children come in that have been wounded or harmed by gun, the use of a gun. We want to prevent that this year. This is time that kids are out for the summer. We want to make sure that we're on the preventive end. While they're out for the summer, a lot of times they get curious. They will look around the house and they will find weapons, and they are curious to know how the weapons work. So if they find a weapon, you have a lock and you can prevent anything of a disaster to happen. So that is why we partner with Children's this year to make sure that they can give out free gun locks to anyone that visits Children's Hospital.
Dr. McCain, for those parents that feel like this could never happen to my child, I keep my gun in another place that they would never find, what would you tell them?
Yeah, your kids know where the Christmas presents are. They know how to find stuff. They're going to get there. They are curious. So no matter how good it feels like we hide these things, kids are going to find them. They're curious. That's what they do. Starting from those toddler ages, those hands are finding stuff. And if you've ever had a little boy around who likes to play with Nerf guns, they're drawn to them like moth to a flame. So it's something that we know that the kids are curious. So it's our job as parents, caregivers, family members, responsible gun owners, to lock up our guns and keep the ammunition stored separately, because these little guys are going to get in it. I think about it just the way I would think about if I had a pool in my backyard. I'm going to put a 4-sided fence around there and I'm going to make sure those kids aren't jumping and trying to get into the pool when I'm not there. Same thing with a gun.
Dr. Hicks, I have a question for you. The health department also can give out gun locks. So at which locations should people seek those?
Yeah, so at the Jefferson County Department of Health, the gun locks will be available at our 3 locations. So our Western Health Center, which is in Midfield, our Eastern Health Center, which is in Roebuck, and then our Central Health Center, which is downtown Birmingham on 6th Avenue. And we're looking to us to be able to start distributing those the 1st of June. And then we will keep that supply coming. And also when you come in to get a gun lock, we also will be equipping our staff to provide you educational information about firearm safety.
In addition, for more information, you can go to jeffcosheriffal.com/be-smart, and you can find additional information pertaining to gun locks and gun safety. Are there any other questions?
Is there a limit to how many gun locks one gun owner can receive? Is it 1 per, or do they can have as many as they?
So the answer to the question would be 2 gun locks would be distributed per person, essentially per household. Because we're going to make sure that we get those distributed to as many people broadly in our community. So we had to set, a cut point, but it's going to be 2 per household.
Any other questions? Thank you so much for coming out. We really appreciate the partnerships that we have now pertaining to gun locks and to help prevent lives, especially our children's, from being killed. So thank you all for coming, and I hope that everyone took something away from this so that you can pass it on, not just with the media, but for people who you know. Pass the information on, and thank you again. Have a good one.